Juliet, Haney's proposal, AB 24, is to require gas stations, bars, libraries, and single-room occupancy hotels to have naloxone on site. The most common type of naloxone is called Narcan. Big picture, he wants to expand accessibility to this life-saving tool. While you might not see it, Michelle Leopold carries a pain that will never go away. The pain of a mother who lost a child.
He loved nature. He loved skateboarding and snowboarding. He was, of course, a thrill seeker.
In 2019, her 18-year-old son, Trevor, died of a fentanyl overdose. The opioid crisis has only grown worse since then.
This is unlike anything our country has ever experienced.
She wants to fight back through education, training, and more. She teaches people how to administer naloxone, such as Narcan, that can rapidly reverse an opioid overdose. She owns several Ace Hardware stores and has Narcan on hand as she does a fire extinguisher.
I am all about getting more Narcan out there, getting more people trained on how to use naloxone, and preventing deaths.
That's what State Assemblyman Matt Haney hopes his newly proposed bill will ultimately do.
Right now, in this moment, we know that having Narcan more widely available can save lives.
Haney knows this firsthand. He walked us through the Tenderloin to the spot he administered Narcan to a person on the brink of an overdose death.
There was somebody across the street who had it, so we were able to run over and they gave us a Narcan, and then and I knew how to use it, and I injected it into his nose, and he came back.
Haney's proposal is to require gas stations, bars, libraries, and single-room occupancy hotels to have naloxone on site in counties across California hit hardest by the opioid crisis.
So these are places that the emergency responders and medical community have told us are some of the most common places for overdoses where this can make the biggest difference. It is a problem that does not limit itself to only cities. It's a rural issue, it's a suburban issue.
The state would provide the naloxone kits to the establishments free of charge.
So this is just an absolute no-brainer.
Ben Blyman owns 2 bars in San Francisco. He recently lost 3 regular customers to accidental fentanyl overdoses that happened elsewhere in the community.
They were consuming a different substance, and it turned out to be fentanyl, and all 3 of them died one day about 4 months ago.
He already has Narcan behind the bar. He says he doesn't anticipate much pushback on the proposal from the bar community, especially since the state would foot the bill.
I can't think of a single bar owner that I know who wouldn't want this immediately, just in case.
Haney says this is just one piece of the puzzle in battling the opioid epidemic.
These are folks who need more help than just Narcan. I recognize that, but they also deserve to live.
People need to know that this is here.
Leopold says the proposal is a step in the right direction. However, she'd like to see more steps taken specifically geared towards addressing the fentanyl crisis among young adults.
I would love to see and support also another measure that talks about education and Narcan in our middle schools, in our high schools, and in our colleges to try and get this message out to young adults.
In the meantime, she'll continue to do her part to teach and train, with help from Trevor along the way. So we're very early on in this process. The bill has to go through the legislative process, and Haney expects the main source of pushback, Juliet, to be the cost, which will likely be substantial.
Boy, you hear a parent's personal story. That's where they're coming from. And then a bar owner's own story of how they're trying to help. And they have it there. I've seen it in the East Bay, and you showed in San Francisco.
Several spots around town, yeah.
Right. So now, if this does pass, how soon could it take effect?
So Haney says that it likely would take some time to unroll, and it would probably be 2024, somewhere around then. It won't affect every county in the beginning either. It'll only start with those that the California Department of Public Health identifies as an area hit hardest by the opioid epidemic. But Haney says ultimately he'd like to see this become a statewide deal as California is truly dealing with this.
Well, we thank that mother for opening up and telling her story, because that certainly comes to all of our minds when we hear her talk about that.
Absolutely.
All right, Max, thank you.